we talk to our patients in great detail about genetics and do genetic counseling, and sometimes we involve genetic counselors because these are genetic diseases and they are likely to recur in the next pregnancy in the given family. And the recurrence rate can vary anywhere between 25 to 50%. And this is a very important topic of discussion because we can treat the index patient, but it is essential to help the family as a whole so that they don't get up or land up in a similar situation in the next pregnancy. So, getting a genetic diagnosis is very crucial. Once we get a genetic diagnosis, we can prevent the occurrence of such a disease in the next pregnancy by performing antenatal tests, something like the chorionic villus sampling, CVS, or amniocentesis. And fetal medicine specialists help us prevent, basically diagnose these conditions in the subsequent pregnancies. I need to tell you that there are different kinds of genetic diseases. Now, there is something called autosomal recessive diseases, which are common in setups where there are consanguineous marriages. We know in India, a lot of endogamous marriages happen within communities, and in several societies, people marry close relatives, wherein you have what is known as consanguinity. In these group of patients, we get autosomal recessive diseases, and sometimes multiple family members get affected. The second group of disorders are autosomal dominant disorders, wherein sometimes we see the child and one of the parent is affected. And the third group of disorders is the X-linked disorders, wherein it is usually the boys in the families are affected. So the boy is affected, the mother is a carrier, and maternal uncles, that means the mother's brothers, are affected. So based on the pattern of inheritance, we do suggest testing for parents and extended family members. And sometimes we end up picking up several patients in a single family and extended family, and then we offer treatment. So we do offer testing to families and extended families, but it would depend on the type of inheritance that we are talking about. We often face resistance. Usually, it is not the immediate family. The parents are often willing to get testing done because they want care for their child. But when it comes to extended families, I would say, don't succeed always, because most of the time, the extended family, if they don't have much symptoms, or if they are polysymptomatic, or if they are being treated for other diseases, then they are not interested to come and talk to us, because until we talk to them and counsel them and make them understand why we want to test them, it is difficult. So we do face resistance when it comes to extended families. In the Western world, you have something called a universal newborn screening programs. For example, in the US and most of the European world, they routinely test for severe combined immune deficiency right at birth. This is a universal newborn screening program. In India, we don't offer such programs. So maybe the step forward for us is to look at offering a newborn screening program to our children,